I did want to take a minute and respond to some of the things that Mr. Klein said in his remarks, that there's an estimate that 23 million would lose their coverage under the Senate bill. The Congressional Budget Office has not yet reviewed the House draft that was released on Friday. I'm confident that when they do, they will find that employer-based coverage will be very strong for a very long time. As the President has promised, if you like the plan that you're in, you get to keep it. That's one of the cornerstones of the legislation that we have here. And the substance that backs up that promise is this. About 80% of American employers are already doing what this bill calls for. That is to provide a very healthy benefits package for people. And when they do, that employer gets exposed to what we call the Hippocratic principle. We do no harm. We say to about 80% of American employers, thank you for what you're doing. We are leaving you alone. We're not making any significant change to your ERISA preemption. We're not forcing you to join any exchange or any other marketplace. We are leaving you alone. What we are trying to do for American businesses and families and labor unions and other institutions is to make health care more affordable. And the way that we're doing that is to require something that's really never been required before under federal law, but that's always been required under our system of organizing our economy, which is competition. In too many instances, Americans live in circumstances where insurance companies are not compelled to compete for their business. In 36 states, the top 2 companies in the marketplace have at least 65% of the business. Let me say that again. In 36 states today, the top 2 providers have about 2/3 of the covered lives and 2/3 of the business. There's insufficient competition. Americans benefit from competition. At our grocery stores, in the housing market, financial services, in so many other areas of American life, when someone has to compete for your business, you as a consumer do better. You have higher quality, more choice, and lower cost. That is not the reality of the health care insurance market in our country today, and this plan makes it the reality. One of the ways we make it the reality is to assure that every American who's in the exchange, who's uninsured and looking for health care, and eventually every buyer of health care in this country, will have the choice of a robust, nonprofit, public competitor to the private insurance plans. Be very clear about this. Rhetoric has been thrown about nationalizing health care and forcing everyone to live under a government health care system. I would first of all say we should ask some of our moms and dads how they feel about a government health care system called Medicare. They're rather happy with it for the most part. But putting that aside for the moment, what this plan does is to say that uninsured people will have a choice of which health insurer is better for them. If they choose a private employer, that's where they'll go. And they'll make a significant contribution from their own income to get there, and they'll receive a subsidy to help them get the insurance they don't presently have. If they prefer the public option, they will have that. But for the first time, we'll have a marketplace in health insurance policies that really does require competition among the insurance companies who offer this coverage. The final thing that I would say is that there was a reference to my friend from Minnesota about the pay-or-play structure and the confiscatory problems for employers. Let me be very clear about this. This plan divides the employer world into 3 categories. The vast majority of American employers who do provide very generous benefits voluntarily, this plan leaves them alone. For small businesses, for the person who's running a small business and struggling to stay ahead, this plan recognizes that an exemption from the employer mandate is necessary. The draft does not specifically speak to the scope of that exemption. Part of the purpose of the debate that begins today is to fill in that blank, is for the members on both sides of the aisle to come up with their best analysis of what that exemption ought to be. But I assure you this, there will be a small business exemption that takes into account the hardworking, struggling entrepreneur who simply can't afford health insurance because her business or his business would go under. And there's a third category of employer that's an employer that has the wherewithal to insure his or her employees but chooses not to. That will change. That employer will have the obligation to cover employees at a decent level because when he or she chooses not to do that, everyone else pays for that now. The employer who does insure, the family who does insure, the taxpayer who pays taxes. So we look forward to this beginning of a process to deliberate, look at these issues, and come to a solution. I just close this one thought, Mr. Chairman. There's some concern about this being rushed. I think it's about 50 years too late. And I think it's long past time we got to this business. I look forward to it and yield back.